Hi, in this video we'd like to continue on our series discussing PCOS. Today's topic we'd like to talk about the abnormal or irregular bleeding that you'll experience between cycles, which is highly irregular and something that you need to get checked on. And this is commonly happening amongst PCOS patients, and today we'd like to discuss why this is. So for PCOS, this disorder, this condition is actually an ovulation obstruction disorder. Not only does it cause hormonal balance, it is a condition that obstructs ovulation. So that means this patient is not ovulating, or she ovulates extremely late compared to healthy counterparts. So these people, either they have no menses at all, for those that are in the severe end. And these women have cycles of up to 30, 40, 50 days. The regular cycle is 28 days. These women have far longer cycles, and some do not even menstruate regularly in a yearly basis, maybe just once or twice. This is why we call it an ovulation obstruction disorder. So because of this ovulation obstruction, there is constant imbalance in the hormones, specifically progesterone and estrogen, which is very crucial in your cycle. So we will see two peaks in a regular cycle, two peaks of progesterone, once in the follicular phase and once in the luteal phase. So for patients who have PCOS, who have far longer cycles, these peaks are not so obvious. And even if they are obvious, even if you can identify them, they're significantly lower levels compared to healthy counterparts. Now this can affect the growth and maturation, the thickening, the vascularization of the endometrium. This is where the shedding, the menstruation comes from. So around ovulation, for patients who observe this condition, around ovulation, they'll see that the hormones are starkly decreasing. Hormones, for example, progesterone, estrogen, that are very important in causing the thickening of this endometrium, they're not sustaining. Instead of peaking continuously, they are slowly dropping off because of the irregular cycle that they have. Now this may have already caused some shedding between your cycles, because it may be already thickened, but then because of the drop in progesterone and estrogen, it causes shedding midway. Now this is actually a common symptom of PCOS. That is why you observe this symptom of irregular bleeding between cycles, which is abnormal. But we cannot tie this symptom directly to PCOS. It's not a distinct symptom of PCOS, and it does need further analysis, further diagnosing whether or not it is in fact PCOS. But if you do observe this symptom of bleeding outside of your menses cycle, in between your cycles, and you have extremely long cycles, or if you don't even menstruate regularly, do not see any menstruation, it could very well be tied to an underlying PCOS. So for treatment for this type of condition, this symptom, still the same is that here at the hospital we do need to do a laparoscopic surgery of the ovaries to destroy or remove these testicular tissues that are fused with the ovaries, deep inside the ovaries. This procedure is minimally invasive. It does not cause scarring, and once we do remove all of these abnormal testicular tissues within the ovaries, we will see the hormones do balance on their own. There will be a healthy balance now, and then you will see that your cycle returns to normal, 28 days. The cycle abnormality, the bleeding in between, and all the other symptoms of PCOS is due to the root cause of presence of these testicular tissues within the ovaries. That is why we need to treat it at its root cause. Upon treatment, patient can see full recovery and also can go on to attain pregnancy and avoid miscarriages. So please do get in touch via the website, as PCOS is in fact a common condition. However, surgical treatment is the most effective way to treat it permanently and also improve quality of life for women who suffer from PCOS.